Hi, I'm Alicia. I want to talk to you about breast cancer. I'm sure a lot of you have already heard of the disease, but there are many risk factors and facts about it I'm sure you haven't heard of. For example, it affects men and women. Caucasian women are more likely to die from it than African American women. 78% of all invasive breast cancer diagnoses occur in women 50 or over. Women in their 40s account for only 70% of the diagnosis. However, breast cancer can and will strike women of any age. Breast cancer is cancer originating from the breast tissue. Worldwide, breast cancer comprises 10.4% of all cancer incidences among women, making it the most common type of non-skin cancer in women and the fifth most common cause of cancer death. Breast cancer is about 100 times more common in women than in men, although males tend to have poor outcomes due to delay in diagnosis. Prognosis and survival rates vary greatly depending on cancer type and staging. With best treatment and dependent on staging, 10-year disease-free survivals vary from 98% to 10%. Treatment includes surgery, drugs, hormonal therapy and chemotherapy, and radiation. The primary epidemiologic and risk factors have been identified are sex, age, lack of childbearing or breastfeeding, higher hormone levels, race, and economic status. A 2007 report by American Institute for Cancer Research and Worldwide Cancer Research Fund concluded women can reduce their risk by maintaining a healthy weight, drinking less alcohol, being physically active, and breastfeeding their children. Several studies have found that black women in the United States are more likely to die from breast cancer, even though white women are more likely to be diagnosed with the disease. A risk factor is anything that increases a person's chance of getting a disease. Different cancers have different risk factors. One risk factor is getting older. Your risk for breast cancer increases as you age. About 77% of women diagnosed with breast cancer each year are over age 50, and almost half are age 65 and older. Having a mother, sister, daughter, or first-degree relative who has breast cancer puts you at high risk for your disease. Having your first child after age 35 or never having children puts you at a higher risk. If you begin menopause after age 55, your risk increases. A family history of cancer of the ovaries, cervix, uterus, or colon increases your risk. Your risk increases if you got your period before age 12. Use of alcohol is linked to increased risk of developing breast cancer. Compare it with non-drinkers. Women who consume one alcoholic drink a day have a very small increase in risk, and those who have 2 to 5 drinks daily have about 1.5 times the risk of women who drink no alcohol. Caucasian women are at a slightly higher risk of developing breast cancer than African American, Asian, Hispanic, and Native American women. The exception to this is that African American women are more likely to have breast cancer than Caucasian under the age of 40. Being overweight with excess calorie and fat intake increases your risk. It is important to help because in 2004, breast cancer caused 519,000 deaths worldwide, 7% of all cancer deaths, almost 1% of all deaths. The risk for getting breast cancer has increased over the years. In 1940, the lifetime risk for women of developing breast cancer was 5% or 1 in 20. The American Cancer Society estimates the risk being 13% in 2009 or almost 1 in 8. There are several organizations that sponsor the research for breast cancer, which include Yoplait, American Airlines, Ask.com, Bank of America, Ford Division, New Balance Athletic Shoe Incorporated, and Remax. There are several things you can do to help this cause, such as donating funds, becoming an activist, participating in events, and buying products whose proceeds go to finding a cure. One of the truly helpful things you can do is support. Many men and women who are diagnosed with breast cancer feel trapped and alone. They are not even telling anyone about their diagnosis. So if you know anyone with breast cancer or know of a support group, support, volunteer, help find a cure.